recording this as well for those not able to join us, or if you certainly want to go back and listen to this again. So with that, moving to our next slide, maybe. There we go. And again, we will send these slides, the recording, and a talking points document out by no later than tomorrow for folks to have, again, at your disposal over the weekend to review, and then again to get ready for those talking points and really feel comfortable with the messaging. So in terms of what we're going to do today, we will walk through what the agenda and agendas actually look for in terms of the day. A little bit on the logistics of the day. We'll do a little bit of that today, and then certainly a lot more of that the morning of and getting you all ready. We will talk about the anatomy of a successful legislative visit and what it looks like to meet with those legislators. Review those policy issues and the key asks, the key messaging in what we'll be asking you to actually talk about in those meetings. How you'll be preparing. So there is some homework at the end of this in terms of making sure you know what you're going to say, how to talk about your health center, and how to prepare. And then at the very end, we will do or have time for questions. That said, if something comes up, please feel free to use the chat box. You know, you can chat those questions into us, and I will either try to answer them as we go, or we'll make sure at the end that we get those answered. All righty, so agenda for the day. So again, this is being held next Tuesday, April 9th. Hopefully that's on everyone's calendars. You know you're coming to Salem. We are going to be at the MICA Center, so we are not in the Capitol building. So for those who have come in previous years, we've actually been in the Capitol. Due to construction this year, that's not available. So do pay attention to the calendar invites and the agendas that come out with the address. We are starting as early as 7. So for those folks, again, driving either down or up, or maybe spending the night, breakfast and registration will start at 7. I am going to ask that folks hold as tightly as possible to no earlier than 7, only because, again, we will be in setting up a little ahead of that, and food won't be on hand before that. But again, anytime between 7 and 8, please feel to come over, have breakfast, read your packets, read your materials. And then we will kick off right at 8 o'clock. It's a pretty full day, pretty full schedule. Again, with that welcome and overview, and then right at 8:30, we have our first legislative speaker, Representative Ron Noble, coming over to chat with us for a few minutes. And then we'll kick off message training again, and a little bit on what it means to be an advocate in your health center. So again, you're going to hear it today, and we're going to make sure you hear it again on the day of. What I will caveat, the next line there where it says meeting with legislators, there are a couple of meetings that are going to be happening as early as 9 o'clock. So again, if you look at that schedule and wonder, how the heck can I get message trained by 9 o'clock? That's the purpose of today's call, to again introduce you to those topics, get you comfortable with the messaging, and then Marty or myself will be reaching out to those who have the early meetings to make sure you are ready, prepped, and we'll have staff with you in those meetings. The rest of the meetings are largely happening after we get through that message training, have some time to spend with you, answer questions, and get you ready. We will take breaks, so I promise there will be time for folks to answer emails, again, to make phone calls. We will have a social media booth as well as a button making station, so just kind of a fun project to do, if you will. We've made buttons. We will have buttons for all of you to wear to be visible in the Capitol, but if you want to make an individual one, you know, actually have your health center name on it, that's a button making station. And again, social media, you'll see the hashtags in just a little bit as we walk through that, but we'll have that also available for pictures and fun. 10:30 to 10:45, we are actually going to hear from our new state Medicaid director, Lori Conier. Again, coming over for just a very brief, 15, 20 minutes to kind of brief us on where she's headed, where Medicaid is going at the state level, and certainly to let you network and ask questions. And then shortly after that, we will have Tina Edlund, who is the health policy advisor for Governor Kate Brown, coming over to again give us kind of the high level priorities for the governor's office. That takes us right into about the 11:15 hour. And running in the background, starting at 11 o'clock, there are actually both chambers meet, right? So we actually have floor sessions for both the Representative and Senate. So if you're interested and don't have a meeting, and again, I'll get to that individualized schedule in just a minute, but don't have a meeting, you are welcome to certainly actually head into the galleries and watch the floor sessions, which can be fun depending on what's up on the floor. Also can be a lot of talking. But again, something that you certainly can take advantage of if you don't have meetings. We also will probably aim to have a group picture right around the 11:30 hour, getting us all over into the Capitol and somewhere in the rotunda just to take a quick picture. So hopefully you'll join us for that. If not, certainly understand. But again, we'll try to get that. Lunch starts at 11:45 and is mostly an open time, right? We don't have any actual presentations scheduled, nothing that you have to get done. So again, it kind of gives you some time to make sure you're catching up on emails, making those phone calls, networking with your peers. And that goes until 1 o'clock. Again, understanding that a lot of those legislative meetings in the afternoon are going to start around that 12:30 time, I think is actually the earliest. And paying attention to your individualized schedule, thinking about when you eat, how you make that all happen. 1 o'clock, we have actually another panel of legislative speakers. And again, actually a combination of both representatives and senators coming over to give, again, anywhere from probably 10 to 15 minutes of chatting with us. It's a great opportunity to ask questions and again, do some networking with those individuals. And then from there, the rest of the afternoon is fairly open in terms of, again, speakers. Nothing scheduled for the rest of the day for speakers, but you will be in meetings. You are most likely going to be in and out of meetings and multiple meetings for many of you. So again, pay attention to that individualized schedule that will be in your packet, but know that we will have afternoon snacks, right? So again, to help you get through that, we will make sure to have snacks, coffee, and water on hand, again, at the MICA Center. And then if you don't have anything scheduled for that 3 o'clock hour or into the 4 o'clock hour, there will be committees also running in the background. So again, in those italicized pieces of either going to a floor session or going to a committee meeting, those are available to attend if those are of interest. What we will talk about shortly as well is that in terms of wrapping up the day, so no matter when you are done with that last meeting, we are going to ask that you return to the MICA Center, partly because we need you to fill out a thank you card. We do need you to thank those legislators for meeting with you. And we will then actually take those, hand deliver those back to every one of our legislators. And we need a report back form on the meeting. And again, those are really critical pieces for us to have both in following up on any issues that you may hear about, questions, concerns, bills that come up, and then again, being able to thank our legislators for meeting with us. So that's the big overall agenda. In terms of individual meetings, so again, because each health center is in either a district or multiple districts, we will be putting together schedules that will be actually probably likely or should be attached to the interior of your folder that will actually lay out what your meetings are going to look like. And again, those can be as early as 9 o'clock. They can be as late as 5 o'clock. There are some of those meetings running pretty late into the day. And again, that's working around a legislative schedule, depending on their appointments, committees, floor sessions, things like that. This is a little bit of a new piece for this year. I know in years past, if you've attended with us, normally staff have been present in your meetings. That may or may not be true this year. And again, we know it's partly because we're going to message train you so well that you guys can do this. I also trust that these are human beings. They love to see you. They want you in their offices and they want to hear from you. And so you will be the ones giving the message. And we know you've got it, right? You guys will be fine. And they really are fun meetings. My intent is that you guys actually do have a good time, feel comfortable enough with our messaging, or just talk about your health center and have a good meeting. So just know that there are enough meetings and enough things happening that you may or may not have that staff person with you. That said, we will be on hand to assist, right? So whether it's getting you from the MICA Center to the Capitol, directing you in the Capitol, going with you to meetings, you will have any one of us, and I think there's about 7 or 8 of us staff that will be on hand. We will be wearing blue to help identify who we are. If you guys want to join us in wearing blue, by all meetings, by all accounts, please do. But again, just so you know, we'll be in blue. You'll know who we are. You'll see all of us in the MICA Center before you head to the Capitol as well. Marty and I also have our cell phones listed. You'll see that in the end of the slides and then on our materials as well. Please don't hesitate to call, text, reach out to say, I'm somewhere in the building, I can't find X. We'll come find you and get you to that meeting as well. Just a little bit on logistics. So wanted to share what the parking is going to look like. And so Marty actually pulled a list of parking options for the day. There is street parking, actually an entire, I think almost mile radius of the Capitol that is 10-hour parking. It's about $1.50 an hour, so a max of $15 a day. And usually, especially at 7 o'clock in the morning, there will be spots available. If you don't mind walking a little bit, the yellow lot is probably the most affordable option in terms of being $6 a day. That's a flat fee. Find a parking spot, get your ticket, and then walk on over to the MICA Center. But that's probably a good, 5-7 minute walk. Not far, but again, just to let you know. And then the Capitol Mall parking structure, again, is something you're actually going to enter below the street, but make sure you're parking up on the top in order to use those 10-hour meters.
And Danielle, if I could just jump in, the yellow lot is open to the public as well as state workers park there, and it tends to fill up about 8 a.m. So if you're getting into the yellow lot by 7:30, chances are you'll find a spot. Anytime after 7:30, you may be circling or looking. So just bear that in mind as you're planning your morning.
Yeah, and that's probably a good point just to think about giving yourself some time to find a parking spot. And if you're at the hotel, if you happen to be spending the night or have a hotel, again, most hotels are within walking distance. The Grand, which is part of the convention center from our event the day before, if you're attending, is within walking distance. I think it was, how long?
Half a mile.
Half a mile, right? So however long that takes you to walk, you can also plan for that and leave your car parked at the hotel. So lots of options. Again, feel free to text, call, ask us if there's any questions around that. Also want to indicate, and I kind of put the graphics on this slide, we will have maps in your packets of how to get around. So again, because we're at the MICA Center and we're not in the Capitol, we will actually be helping direct, again, where you're going to be walking from. And I'll tell you that it's literally a right out of the MICA Center, straight up the street. You can see the Capitol building, so you shouldn't get too lost. But again, that's probably going to take you about 5 minutes to walk. So that'll be really critical to understand needing that time to walk into the building and still get to your legislative meetings. And then the other map there that says first floor, again, these are going to be the actual Capitol floor plans, and those will be included for all 4 floors, in fact, 5 floors of the building. Just so, again, you can kind of see where you might be going or need to be for those meetings. Come back here. So the day of details, again, we will do a lot of these details in person on the morning of, doing a lot of logistics pieces. But just wanted to give you a heads up, we will be using social media and encouraging folks, if you have a health center account, so again, if you've got a Facebook account or a Twitter account, to post about what is happening during the day, right? Is there pictures you'd like to post? Is there something that was said by a legislator that you want to share? Any of that would be great to share. It gives, again, a lot of visibility for OPCA and for your health center. And then the 2 hashtags that we will use, you'll see there, and again, we will have those scrolling and available at your tables to actually look at and know what those will be. Really important point, we will be providing your food. So again, you are not expected to actually have to get any of your meals during the day. We'll have breakfast, lunch, and as I mentioned, those afternoon snacks available for folks. There is a cafeteria in the building. There is a downtown and all of that in the event that you need something different or if you're staying for dinner. But again, we will be providing that breakfast, lunch, and afternoon snack. As I mentioned earlier, feel free to join us in wearing blue. If you've got blue and want to wear a color again to help be visible in the building and to start to promote that, feel free. Blue scarves, shirts, dresses, you name it, whatever that looks like. We will also be handing out as part of your packets a tote bag that's got the OPCA logo on it, those buttons as I mentioned, and then we've got just kind of a fun swag piece to go with that as well that I will leave for you guys to discover. But again, trying to raise some of that visibility and really demonstrate that we have up to 70 people in the building at any given time on April 9th. So pretty excited about that. That should be a good presence actually in the Capitol building. All righty, so switching gears a little bit into the actual messaging and again, what those policy asks are going to be and the key issues. As we do this day, and what's really critical to understand is what does it actually mean to be an advocate, right? What does it mean to come down and talk about your health center with a legislator? And the best way to think about this is one of those things of, have you ever tried to get a family member to do your chores? Maybe it was a coworker to attend a meeting for you that you really didn't want to go to. Were you successful? Did you get them to do it? If so, you're already an advocate, and guess what? You know how to do advocacy. It is not hard to do. It actually, again, can be really fun. It can be very rewarding. It is about telling your story and making it matter. So again, it's the practice of educating individuals on your issues to help them make informed decisions and possibly be persuaded by your arguments. But again, for our health centers and what you will hear Marty and I talk about in years to come as we do this work, is it's really about telling your story and making that matter that impacts how a legislator may make a decision or think about something or that bill or policy or program because you've had an impact in that story. In terms of a successful legislative meeting, so just to give you a sense of what that meeting is going to actually look like, what it means when you arrive at that legislative meeting all the way to the end of the meeting. Meetings with legislators can be anywhere from 5 to 25 minutes. Just going to depend on how much time that particular legislator has, what their schedule is looking like for the day. They also may just pop in and say hello, which means you'll most likely be meeting with the staff, or again, some combination thereof of staff and the legislator. It is really, really critical to understand staff are key to this work. So if you do end up meeting with a staff member or a couple of the staff members, there's usually a few floating around, please know that's not something to be offended at. That's not a lesser meeting. It's actually probably a more important meeting. Staff are really, really critical to this work, and they're actually the ones that probably have the most sway with their bosses, those legislators, in terms of making an impact on whatever policy or issue we're talking about. So when you do arrive, once you have gotten to the building, located where your meeting is, and again, when you look at your legislative appointments, the number that the meeting room starts with is going to be the number of the floor. So for example, if your meeting room says 215, that is going to be on the second floor, and then either on the House side or the Senate side. And again, we'll go through that on the day of, showing which side is which, but again, just know whatever room number it is the floor you are going to. Once you find that office, please make sure you check in with staff, let them know who you are, and that you have a meeting scheduled with the legislator. Again, you want to make sure you're checking in, courteous, and letting them know they're there. They will not approach you. They will not assume you are there. You need to do that check-in. Be on time. That's going to be also a really critical point. Again, legislators have tight schedules. If you're not there, that's less time that you will get with the legislator as well. Do start your meeting by doing introductions. So again, make sure all that are present, because many of these meetings are going to be with multiple health centers. Again, just depending on the district and the legislator, you're likely going to have at least 2, if not 3, health centers in that meeting. Make sure you introduce everybody. And please don't go in by yourself. I guess we've had some examples in years past of, again, just starting that meeting, not waiting for your colleagues. Make sure everyone's present, ready to go. Your name, the health center you represent, and then your health center story. So it's a good opportunity in those introductions to share a little bit about where your health center is, the sites that are in the district, and again, we will have handouts that actually demonstrate that, and then a little bit about what makes your health center special. And we will get to that piece shortly in your homework of what your elevator speech is. Once you've done that in the first, that probably takes you anywhere from 5 to 7 minutes, just depending on how many are in the meeting. You will want to state the issues relevant to health centers and what we're going to ask you to actually message on in my next couple of slides. Along with that, you do want to state positions clearly, right? So the legislator is going to want to know right away, are you in favor, in opposition, or neutral on the particular bill or issue that you're asking them to consider. In this case, I will tell you for this year, we're asking for support. So as you'll see on the slide, it actually says ask for support. We are going to be asking our legislators to consider the tobacco tax increase and really advocating for that to work its way through the legislative process. You can wait for the response, right? You do want to actually see if they will tell you where they are or aren't. Some of them will, some of them are going to want a time, have more conversation to hear from the experts. But again, they're going to want to hear from you what you're interested in and what you support. Once you've done that, make sure you thank them, again, for that position or wherever they might be. Do invite them at the conclusion of the visit to visit your clinic, right? The biggest piece and what we know has some of the best impact is when they come out and see your clinics in person. And we have a lot of new legislators this year. Just given, again, that we went through an election process, we have lots of new faces in the building, lots of new committee assignments. They don't necessarily know who we are or what you do. So getting them out to the clinic is a really critical point to make at the end of the visit. After the meeting, so once you've left, you can either find a space, in the hallway, there's often seats, you could head back down towards the rotunda, or head back to the MICA Center, and we are going to ask that you fill out a thank you card, and those will be in your packets. They are going to be handwritten thank you cards. Really important, again, that we thank our legislators for meeting with us. And then that meeting report out form. And again, that's going to be in your packet. We only need 1 report out form per meeting. So again, if you've got 2 or 3 clinics in the meeting, decide who's going to fill it out and just make sure OPCA gets 1 copy. That is also really, really important in terms of any follow-up that needs to be done. And again, it's critical for OPCA and for the relationship and the continuation of this work that we do in the building that if there is something to be followed up on, we need to know about and we need to get back to them on that particular issue or question. It goes without saying on the last point there, but again, always be courteous and respectful. We are working towards building positive relationships. Understanding that the legislator could be having a bad day, doesn't like our particular issue, doesn't like us for whatever reason, not usually the case. But again, we want to leave with only the positive, make sure you're thanking them, and being courteous, which gets to my do's and don'ts of a legislative meeting. I'm not going to read this for everybody. This will actually be included in your packet as well as a handout, but kind of gives you a sense of what should be done in a meeting versus what shouldn't. And again, trusting that most of you probably do this in your everyday lives as well, but important to state nonetheless. The ones I will highlight, do be honest. Again, if you don't know something, please don't make it up. Don't come up with an answer. Just tell that legislator, I'm not sure, or I don't know that answer, but I will get back to you. And then use that report out form to let us know. Do express gratitude. Again, as I just mentioned, we want to leave with a good taste in their mouth, a good relationship, and the way to do that is, again, to thank them for taking the time to meet with us. And then on that don't side, what I just mentioned there, please don't make it up. Again, we want to be seen as trusted partners, as reputable partners who actually know what we're talking about, And so if you don't, we'll make sure we get them an answer, find the answer, and that's a normal, we do that a lot. In fact, we do that in committee hearings, we do it with legislators. It's a normal piece of the work. All right, goals. So in terms of what our messaging is and what we'd like to see come out of these meetings, is to educate legislators on the importance of Medicaid and the need for stable funding. And again, as many of you have been hearing, you've probably seen in our policy and advocacy updates, or hopefully you're sharing with your board members as well, is that Medicaid this year does have a funding shortfall or a budget hole. And in terms of keeping access and eligibility and no cuts to Medicaid and for reimbursement, it is really, really critical that we are talking about what the importance of Medicaid is to our health centers. We again are going to share the impacts of community health centers on the people that we do serve and on your patients and what it means to be a health center. Again, as I mentioned, many of our legislators are new, haven't done this work, are new to healthcare. There's a lot of them that actually are very, very new to healthcare and don't know what it is you do or the impact you have. And then again, we're connecting with legislators to strengthen relationships and thank them for supporting health centers. And again, across the board, I would say most legislators are very, very supportive. You will hear them say that, I know my health center, or I really like this model of care, or you guys are doing everything. From a bipartisan standpoint, we have really good support in the building generally of our health centers. So again, we are working on strengthening those relationships and really demonstrating what our value and our impact is to the state. So to our actual messaging. So we have three pieces or components of the meeting for messaging. The first of that is actually kind of the easy piece that you guys will be doing. And again, these meetings will flow a little bit organically. If you hit every point, great. If you don't, please know it's okay if you didn't get to everything, right? We want you to have a conversation. We want you to be having good conversation that happens organically. But if you can, these are going to be the messaging points. The first being who you are as a community health center. So what you'll actually see is the collective messaging. So those first two bullet points actually speak to who we are as a network within the state. So again, we are local nonprofits and public entities that deliver integrated primary care in rural and underserved communities across the state. It may be important to define integrated primary care, right? Again, we all assume or know what that means. Legislators may not. So you actually may want to talk about the fact that you do physical, behavioral, and dental health, and maybe vision, depending on your clinic, again, in those communities across the state. We collectively serve 1 in 10 Oregonians. That is a really key and important point to make. That's approximately 433,000 patients in the state, and then employ over 9,000 providers, staff, and community members. And then from that, what it will give you is a jumping off point also to talk about what each of your health centers does as related to those 2 points, right? So how many Oregonians do you serve? How many of those are Medicaid patients? And where are your sites, right? What's really important, especially in the particular districts that the legislator is representing, is where are the sites that you're actually serving and the patients that you're serving. And again, that's going to be your homework and your take-home piece in the next couple of slides that we'll talk about. The next request, and this is not actually something we need to get a position of support on, but what we would like you to raise with the legislators is that stable support, or I should say support for stable funding for Medicaid. And again, as I just talked about, being that we are in a year of about an $800 million hole in the budget, it is really important to talk about what Medicaid means for your health center, what it means to our patients, and what that means we can do for our patients, right? So that when we have, access and funding for Medicaid, we can take care of our patients, and we can also use those enabling services or comprehensive services to then expand into that social determinants of health work. Again, I've included the collective talking point of we serve 1 in 4 Medicaid patients. That's about 245 or just over 245,000 Oregonians. And again, that's that's a quarter of the patients on Medicaid in the entire state, right? That's a really critical point to make of how many we do serve. Again, be ready to actually state what your numbers are. You know, so if you can say we have X percent of Medicaid in our clinic or X number of patients, that's a really helpful talking point. You may want to talk about House Bill 2010, and this was actually passed in March of this year. This was the first component of our funding that actually fills approximately half of the funding gap. What I would say is this would be a great opportunity to thank our Democratic colleagues. This bill, unfortunately, in both houses, passed on a partisan vote. And when I say partisan, that does mean only one party voted in support. That currently in our current chambers is the Democratic Party. So every Republican essentially in both the House and Senate voted against this bill. And again, not so much about us as health centers, more about just where they are in terms of party politics. If you want to talk about that, you can call me in more detail. But again, want to make sure if you are meeting with a Democratic legislator, and I think we've got that in all of our materials of indicating, you know, which party each legislator is in, please make sure to thank them for that vote. That was a huge lift. The governor supported, saw that very, very early on in the session. Then the most important piece to really probably focus on again is what we use Medicaid to do in order to serve the patients we see. And so that's your third bullet point. Given that the majority of our health center patients, usually again within your clinics, are on OHP, ensuring that they maintain that access to integrated primary care or physical, behavioral, and dental health services, again, ensures that we can then focus on complex needs that improve the patient's health, including factors that contribute to overall health. And again, it's a great opportunity to talk about, you know, how you've integrated things like substance use disorder, opioid use disorder components. It might be that you're doing, you know, food insecurity programs, SNAP and WIC and things like that, using community health workers, whatever that might look like. By having stable funding and ensuring that they can use their Medicaid, we then ensure that our patients have, you know, are healthier and better outcomes. And the last bullet point, the one you guys are probably the most used to, is again, share the impact of coverage in your health center and how, again, that's going to improve overall health of patients. Triple aim, you want to get into that, certainly can get into that. But again, just really thinking about what that impact of Medicaid is for your patients. And again, we will have a one-pager that outlines and details all of these talking points again that you will have by tomorrow to make sure you're seeing this as many times as you need to see it or get comfortable with, and then we will talk about it again on the day of in that agenda section. So the one piece, continuing our messaging and what we are going to ask that you take a position on, or that the legislator takes a position on, and hopefully we'll share with you, is to encourage support for raising the tobacco tax. So the tobacco tax, and it's House Bill 2270 right now, is one way we are looking at filling the other half of the budget hole for Medicaid, right? So again, we're looking at about a $400 million, thereabouts, hole still to fill. One of the strategies to fill that would be to actually raise the tobacco tax. It does increase the tobacco tax by $2 a pack, and then taxes e-cigarettes and vaping products for the first time. That is a key message for many of our legislators to understand, that it's not just tobacco itself. It actually allows us to tax those e-cigarettes and vaping products that, as we know, many of our teens are actually starting to use, and is a gateway actually into smoking. It also allocates 90% of the funding, or the new funding that we generated from this kind of tax, to Medicaid, but 10% to public health for cessation, education, and prevention programs. And again, another really key point to understand and to help talk about. We are finding that messaging that resonates right now with most of our legislators, or many of our legislators, is to talk about the impact on teens and kids. So as you probably know, you may be seeing in your health centers, is the increase in the number of younger kids and teens picking up either e-cigarettes, Juul, vaping, whatever you want to call it. They'll often tell you it doesn't have tobacco in it or it's flavored, it doesn't harm them. Again, a lot of that messaging that's out there, it has nearly tripled in the last 5 years. And that's actually in both the e-cigarettes and traditional cigarettes. What we know is that research or data is showing that if you do increase the price of tobacco and vaping products, it is the greatest barrier to kids and teens actually starting smoking, or again, using those e-cigarette and vaping products. So again, really key point, it's a barrier to kids starting. We don't want kids starting. And then it also inhibits or impacts their ability to buy the products as well, right? So again, if you increase the price or you start taxing the things that they're using, that potentially has an impact in their ability to purchase. The third point there, and this is the one that we probably want you to focus the most on if you get an opportunity, is we have a really good opportunity as health centers to bring the health center voice to this particular conversation to help legislators understand the benefits of this kind of policy, right? So regardless of what they think of this being a tax, because what you're going to probably hear is some pushback to any kind of revenue being raised, it's a tax, we don't want a tax, is that this kind of policy, when we implement any kind of increase on smoking, it actually increases the likelihood of cessation. If we can do that, the impact on our patients actually means their increased likelihood of not smoking, right, or of them ceasing smoking. It decreases their risk of cancer and decreases that premature death and lifetime of chronic disease that they would be facing. What that means for the health center, for you again, is that that moves you away for your care teams and for your patients from having to focus on chronic disease management, right? You're no longer having to focus on, things like COPD, any kind of heart disease, asthma, right? Increased asthma attacks because you're smoking, whatever that looks like. And again, shifts your focus and the care team's focus to then really helping the patient live a healthier life. And again, what does that mean in outcomes? What does that look like? It could be helping them get access to food resources. It might be to actually getting housing, because now that they don't smoke, they can get better housing. Job training, right? Can they actually then get a job where they're not taking breaks every 15, 20 minutes? Whatever that looks like, whatever stories you might have to share on that, those are key and critical components to this conversation. The other reason we are asking you to advocate on this particular bill is that there is a coalition of which OPCA is actually part of, working to try to get this through the building. And when I say that, we'd actually like to see this be passed by our legislative body before it gets referred to the ballot. Because what you can expect is that if this does get passed, and even if it doesn't, we are likely to see this actually go to the ballot and be voted on by the entirety of the state. If it passes a legislative measure, it is a much easier campaign looking forward into how we can actually advocate and support this kind of revenue raising on a ballot initiative than if it doesn't. So that's just to kind of give you the background of where we are, where our policy committee is. This has actually been vetted through our policy committee. This is something OPCA is fully supporting and working to get passed in the building. And I promise we will take questions. Feel free to type those in the text box. But that takes us pretty much through the key messaging points, what a meeting looks like, and what our day is going to look like. Just to reiterate, as I mentioned earlier, a little bit on closing out the day, making sure you get those thank you cards filled out, the report back forms filled out, and returned to the MICA Center. So you will have to come back. We can't quite let you off the hook straight out of the building, but would ask you, please, please, please come back and turn those forms in. And again, that ensures our relationships and our work in the building moves forward. And we'll feed you, I promise. There'll be snacks, water, and coffee. Okay. The final pieces, and I promise we're almost to the slides, is your homework. So your takeaway from this session is what to prepare in terms of being ready to talk about your health center. And this, for ease of reference, we do call an elevator speech. Again, this is generally a speech that you can give in 2 to 3 minutes and very quickly share what it is about your health center that makes it so impactful and brings you to work every day. So what is it that brings you to work daily? And this is one of those things of, is there a story that you can share? Is there something that you really, when you're at family gatherings and holiday parties and somebody says, what do you do? Is there a story that you like to share that really brings home what it is you do? I would just share, we were recently in DC doing Hill visits with our federal legislators. We had a great story out of Lane County around kids being immunized and getting superhero capes as protectors against disease, right? And so really making that a fun thing for kids to do, given that it's not usually. But doing pictures, giving them a cape, and sharing that as a way to, again, increase the rates of immunization and keeping kids protected against disease. So that's a really good example of impact your health center has, creative ways you've come up with getting those programs going. What has it meant for your patients to access care, right? Do you have stories or patients that have told you directly, what has it meant to actually be able to come here? What does it mean to have a health center, in their community workers that they trust, or physicians and the staff that they trust? And then if it applies, is there things you've been able to do or fund in terms of new services, programs, or positions through either a CCO incentive, alternative payment methodologies, or just outside funding, right? I mean, have you been able to do something new and different, or a new building, for example, a new site that you can share, again, to demonstrate what that looks like? I would ask that you be ready to highlight, as I kind of mentioned in that opening, again, when you do your introductions, your patient population demographics, your number of patients served, and then where the clinic is located. Some of this will be in the materials we're providing. We have a couple of one-pager reports that are actually going to show where your clinic is, a lot of that detailed information around economic impact, things that we'll be leaving behind for the legislator. But again, the more that you can easily speak to that, the easier that is for the legislator to understand. And again, gave you just some examples there of what you might want to think about preparing. And then if you are attending with colleagues, and again, have more than 1 or 2 of you coming for the visit, you may want to consider preparing that as a team. Just again, so you're on the same page, and then one of you can speak to it. You guys can switch back and forth between meetings, but again, knowing that you'll have the same messaging and able to give that speech. Or you can actually become an advocate and make your colleague do it. So with that, your next step is going to be homework. Prepare that elevator speech. Think about that over the weekend. Spend some time with the materials that we'll send you and get ready to do those visits. Familiarizing yourself with the key issues and asks. So again, that key messaging around who you are, what Medicaid means, and then the ask on the tobacco tax. And then if there are any specific materials, if there's a one-page or a handout that you would really like to give your legislator, please bring those. Be prepared to add those to the folders. We're going to ask that you guys bring those and do that on your own, just because we have a lot of materials to get into packets. But again, we'll have those packets ready and can add those the day of. And then last but not least, if there's any changes to registration, additions, cancellations, we need those like now or yesterday. So we'll just ask that you let us know ASAP on that, in part because we are actually at capacity. We've actually extended or opened up a few more registrations, but again, are really excited to have that problem and also want to make sure we know of all changes and cancellations, because again, that impacts the actual meetings we're doing in the building as well. All righty, with that, I will unmute everybody. And then if you also want to be able to use the chat box to ask questions, we will go through those. And let me do that really quick. All right. Oh, and so there's a question around where are the parking lots?
I think, Danielle, those 3 bullet points that listed the parking lots, the addresses for those parking lots are listed with those bullets. Just pop those. I confirmed with both Google and Yahoo Maps that they're accurate. So just pop those in either your GPS, phone, or computer and map that out before you leave with a plan. But they're pretty obvious once you get close as well.
Again, if you can't find them on the day of, call us. We'll help direct. All right, that was the first. Are any of the legislators we will be talking with healthcare professionals like a physician, RN, chiropractor? There's a handful still in the building, actually. So Senator Manos Anderson, who's also the chair of the Senate Healthcare Committee, is a public health RN, retired, but still very much engaged in that. Elizabeth Steiner Hayward, who's actually going to be one of our speakers at the 1 o'clock hour, is a physician and still a practicing family physician, used to work at Richmond, so has some FQ experience. Rachel Prusak, who's a new representative, is a NP. Who else have we got?
This is Cassie.
Hey, Cassie.
Representative Scouten.
Scouten, thank you.
Nurse. Mm-hmm.
Yeah,
formerly Maelstrom.
Yeah. Oh, that's right. So there you go. You can test our brains right out the gate. We will make sure to call that out. You know, you hear that in introductions. The other piece I was looking at including is some of the bios. And if you're curious about any of your representatives, all of their bios are online. You can just search them and actually read about them. And you'll have some time to do that on breaks, or again, if you have questions about who you're meeting with, find Marty or myself. Cassie or John will also be around, any one of our staff, and we can help get that answered. But great question. Okay, and will we be able to see the schedule of who we'll be meeting with prior to Tuesday? Likely not. So we have been working all week actually on getting those assignments made. If you have any concern about the timing, right? So if you have a phone call, I know we've seen a few emails already around, you know, I've got something else scheduled, when's my meetings? If there's a specific conflict or something that you need to be in, please email Marty or myself, and we certainly can get that breakout to you. But in terms of turning around 70 people's individualized schedules, that's probably a little more work than we can take on or commit to. But again, if you have questions or if you just want to know who your legislators are, feel free to email us. We can certainly get that out on an individualized basis as needed. And then how many copies of the one-page documents for our clinic are needed? Great question. If you are going to add any additional materials, I would probably say bring up to 5. Is that enough? Sorry, I'm looking at Marty. In that, again, many of you are going to have multiple meetings, just given where your clinic's sites are actually located. So yeah, I'd say even 5 to 10. Make sure you've got a couple extra on hand, but that should be plenty. You definitely don't have more than 10 meetings, I promise. Have we seen arguments against tobacco tax that are similar to, I think that says 558, or sugar sweetened beverages? That is a good question. You know, I think we are not focused as much on the arguments against, I mean, given that we know where big tobacco generally is, and I would tell you that they are in the building, they are monitoring committee meetings, they are videotaping things, actually. It's been fascinating. We do have hearings. We just got word actually that the House Bill 2270 will be heard on the 10th and 11th. So there will be a lot of gear up day before, which actually is on our day the Capitol is. So you guys could be actually on a kind of exciting day in the building. I will also tell you that it's a day where all of the bills that need to be worked have to have been scheduled for a work session. So committees could actually be very, very interesting next Tuesday. But yeah, I don't have that direct answer. I'm happy to get back to
Danielle, I can jump in. So yeah. I think the short answer is yes. There are a number of lawmakers on both sides of the aisle that are extremely concerned about how a tobacco tax will impact those who are underserved or in the lower income spectrum. There are a lot of different ways to have that conversation, but what I'll say in short is that the folks who are going to pay this tax are primarily your patients in your health centers, and so they are utilizing healthcare. They're utilizing the services either through federal funding or state dollars, and what that means is that we are reaping, or rather, we are supporting healthcare for the people who are underserved and are underrepresented in our communities. And the other piece to that that I just want to, from a political standpoint, I suppose, is that big tobacco purposefully targets people in low income and underserved communities. And that's not because people in those communities have a greater propensity to use tobacco products, but it's because that's what they found is the most successful in terms of marketing, and so that's why they go after folks there. And again, these are our patients, these are our communities, and so while the argument has been made in Salem, again, by Democrats and Republicans, that it can be regressive, it is more important that we use the counterpoint of this is a way to help people stop using tobacco and make their lives and their health better. So rather than get into the debate about the regressivity, think of it in terms of helping people stop smoking or start using.
Marty, that helps, and I apologize, I can't read the chat box. So that is all the questions I have in the chat box. Happy to open up the floor. You can take yourselves off mute. I have you all unmuted if anyone has any last minute pressing questions in our last about 3-4 minutes.
Danielle?
Yeah.
Hello?
I can hear you.
Oh, okay, thanks. Yeah, I do have a quick question. I missed the first part of this, and someone was referencing the printouts or handouts. Are those individual handouts that folks are making, or are they referencing the one that you provided us that you gave to staff with Blumenauer staff?
Exactly. So yes, if you've been to P&I with us and done Hill visits, very similar concept on the individualized schedules, right? So there will be, and probably what I was talking about was we'll have the day of the full day schedule, and then inside your packets will be your individualized schedule of all the meetings you will be going to. And then in terms of other handouts is, again, we will have a leave behind packet for the legislator with actually individual clinic documents in terms of what we have for a one-pager, an OPCA one-pager, a tobacco one-pager, again, a few documents to go in. But if there is something that you have as a clinic, right, so a brochure, a one-pager, a handout, that's the one we would say bring 5 to 10 copies of that you can add to that leave behind packet.
Okay, great. Thank you very much. Appreciate the clarification.
Nope, happy to do that. Okay, not hearing a whole lot. I'll give you at least a minute back of your time. I would just note, again, you've got a slide. These will be sent out with both Marty and my cell phone numbers. Please put those in your phones, write them down. We will be available, and again, staff will be on hand to help, assist, to guide you all through the day, and we will again have much of the same conversation day of, but with some of the logistics built into that and a little more of the advocacy piece. So looking forward to seeing all of you on Tuesday morning, bright and early. And again, reach out to us as needed over the next couple of days with specific questions or things that come up. And then feel free to share this with your colleagues again that couldn't join. We will have that posted to YouTube and that handout out by no later than tomorrow.
Danielle?
Yeah.
Danielle?
Got it.
Danielle?
Yeah.
Yes. The second phone number you have listed has 5 digits.
Oh, yeah, you're right.
At the end.
I will get that corrected before we send that out.
Thank
It
you.
is 0469. Thank you.
Thank you.
All right. Thanks for calling that out. We'll get those out and look forward to seeing you Tuesday. Thanks, everybody.
Thank you.